Hi, I'm Taylor with the Center for Caregiver Support, and today we have a wonderful guest with us, Genevieve Falk with Aging Care Advocates. And I wanted to invite Genevieve on because she is a geriatric care manager, and I wanted her to help our audience in understanding why somebody would hire a geriatric care manager and really what a geriatric care manager is. So if you can help us out with that, Genevieve.
Sure, I'd be happy to. Thanks so much for having me.
No?
Well, a geriatric care manager does a couple of things. One, they educate the older adult and their family about different resources, different challenges, and different issues that the older adult might face along the journey. Also, they guide the family and the older adult through different issues that might occur, different situations, different challenges and struggles. And help get them through the healthcare maze. Every time I talk to someone, they say, "Oh my goodness, I just don't know what direction to go in. I've never been through all this before, and it feels like I'm stuck in this maze." And I say, it's a complete maze, and we're here to help guide you through it by offering suggestions, strategies, solutions, resources. That is really our job. In addition to that, we also advocate. That's a big part of our role, is that we advocate for the best quality care of older adults and disabled adults, and with really the interest being not only to make sure they have the best quality of care, but also to put the caregivers and the family members at ease, knowing that there's someone on their side helping to advocate for their loved one, to make sure they get the best care possible in any setting, whether it's at home, whether it's in a hospital, whether it's in a skilled nursing facility, rehab center, a nursing home, or assisted living or memory care. We're there really to help partner with the family, partner with the older adult, and partner actually with the facility or the healthcare system to make sure that the patient gets the best quality care. That's our goal as a care manager.
Okay, so do you work with families that are local and elsewhere? How does that work?
Yes, actually, we're usually hired by an adult family member who's usually a child. It also could be a trust officer and an attorney or someone else that's a relative or a POA of the older adult or the disabled adult. And oftentimes they might be long distance, they're really concerned about their loved one here in the Tampa Bay area, and they want to make sure that that person is getting good care, but they can't be here. And it might cost a lot of money to come into town on a regular basis because mom keeps having falls and keeps going to the hospital, or dad keeps having issues with getting into car accidents because he just really shouldn't be driving anymore, and he just doesn't know, the family just doesn't know how to handle that. Those are some typical examples of how we get involved and partner with those family members or other professionals that are powers of attorney to help strategize and make sure that the older adult or disabled adult is safe in this area.
Okay. Now I know, I've worked with a lot of families through the years, and many families wait for a crisis. When would be the right time for a family to bring in your company to help them through their journey?
Well, I always say plan ahead if you can. Waiting till the crisis is not ideal. So the sooner you can get together and with your family, with a geriatric care manager, with a professional, with an elder care attorney to strategize and plan for the future for your aging loved one or disabled loved one, the better. So what I always say is it's important, you wouldn't go to as a coach, you wouldn't go into a game without a playbook, right? The coach always has a playbook or a plan book or a playbook for the game. Well, I encourage people to make sure that they go into this journey of aging, the process of aging, with a caregiver strategy action plan book or a playbook. So what I really suggest that to be is a notebook of resource information that you've gathered over the years or months or whenever you start this process, to make sure that you have all the resources on who you would go to if mom needed home care, who you would go to if dad needed an elder care attorney, who you would go to if you needed a geriatric care manager for the person you're serving as power of attorney for. We want to make sure we have a list of resources in the area, that we know where to go and who to go to when the time is right. And that is actually something a geriatric care manager can help strategize and plan ahead for you and your loved one, to make sure that when that crisis arrives, we're ready for it. We've got our plan book. We're ready to go. We know the resources, and there's going to be bumps along the way, but that's why we're here, to help strategize and help with those bumps along the way to make them as smooth as possible. Certainly, this is not an easy journey for any of us. We are all aging. We're all in this boat together. The goal is to make sure that the journey is as smooth as we can make it, not only for ourselves as caregivers, but for our loved ones that are aging and going through all of those changes, which are so very stressful and very difficult to get through without support.
True, very true. I wanted to talk about cost a little bit, just so that families know what to expect. So can you share a little bit about what the cost might be?
Sure. A lot of times family members, when they hear what we charge, and nationwide it's different, but the average is about $125 an hour. And a lot of times when I say that number, people say, oh my goodness, I can never afford that. And I say, well, a lot of times what will happen is if families will put their money together, hire a geriatric care manager for just even an hour of time as a consult, so that they can sit down and come up with that action plan with the geriatric care manager and strategize on how to help work through some issues and make sure that there's a plan moving forward. And oftentimes family members can afford that. Certainly, it's not affordable for some people, and that's understandable. When that happens, I think that it's important to know that many geriatric care managers do give back. And it's always important just to give them a call. They might kind of walk you through on the phone a few little resources that will help get you headed in the right direction. I went into social work to start because I want to help others live a better quality of life. And I started the company because I saw so many things, so many older adults falling through the cracks in the healthcare system, working as a social worker. And not only hospitals, but skilled nursing facilities. I saw so many little things falling through the cracks, and I find that these patients would end up coming back through the facility I was in, and it just really frustrated me, and my heart just bled for those older adults that kept going in and out of the system. And I just wanted to find a way that could make a difference for them and improve their quality of life. And in turn, that would improve the quality of life of the older adults' whole entire family system. So I think that it's good to know that people that do geriatric care managers, they love and want to help you as caregivers. So please, if you have questions, concerns, comments, just reach out to a geriatric care manager in your area. You can always find one by going to www.caremanager.org, and you will find a listing in your area wherever you are around the country. The other part of that is a lot of family members will, like I mentioned earlier, fly in from out of town. Maybe they live in Washington. They've got to fly in when mom or dad has a medical crisis. Well, we can be here. We can be the boots on the ground here in the Tampa area to go to the hospital, to bring mom or dad's personal belongings to them, to make sure they have their cell phones working, that if they don't have a cell phone, let's get them a cell phone so you have a way to communicate with them while they're in the hospital, to advocate with the staff at the hospital and the doctors to make sure that your loved one is getting good care. And then when it's time to discharge, help with that discharge process to the next whatever appropriate placement that might be. It might be a rehab facility, it might be assisted living, it might be back home, but helping with that transition, not only choosing the most appropriate place, but also making sure those resources that are out there that someone might be eligible for financially, that those resources are tapped into, and that those older adults have the support when they go to the, let's say, skilled nursing facility, assisted living, or at home. And especially at home, if they're living alone, we want to make sure we support them when they return home so they don't end up back in the hospital system. And that's a huge goal. And a lot of family members over the years say to us, and you can, every geriatric care manager has a testimonial part of their website, but I hear people say all the time, I wish I had known about you sooner. You would have helped me so much if we had known about you 2 years ago. And so I just encourage you to think about it as an option that can help you and help your older adult or disabled adult loved one get the best care possible. And even if it's an hour of our time, or we work on an ongoing basis doing advocacy in a facility or advocacy at home to ensure good care, give us a call so we can help, whether it be our company or another care manager or geriatric care manager's company. Do that, reach out, get help. It's there. We want to support you through the process and through the journey.
I love that you said it's there, because there is help, and I think that all of us who have been in healthcare for quite some time, we really do, like you said earlier, it's your service, it's your mission, and you know, there are resources out there that, you know, we all want to point people in the right direction. How would somebody get a hold of you?
Well, to get a hold of us, you would just call our office number, which is 813-246-4120, or go to our website, which is www.agingcareadvocates.com. And we'll be happy to help. And even if you feel like we're out of your price range, it won't work financially for you, still call, because we can point you in the right direction. So I encourage everybody to consider either our company or one of the many other wonderful geriatric care management companies out there by going to www.caremanager.org to find one near you.
Good. Well, Genevieve, thank you. I know I've seen many situations over the past few months where people were in crisis mode and not able to get into the hospitals, and not able to really even ask questions. So I'm really just trying to provide a service to our community where they know that there are avenues that they can make a phone call. All it is a phone call to see if you're able to help, or another geriatric care manager. So thank you for your time today.
And right now during this crisis, which we're all going through, and it's impacted us all so greatly, you know, one of the things that I encourage everyone to do is have someone that can call up and speak to the facility if your loved one is in a facility, whether it's a hospital, nursing home, or rehab or assisted living, and make sure that you are asking questions about their care, not just how is mom or dad doing, but how are things going? How is she or he eating? How are they toileting? How are they transferring? Ask some more detailed questions about their overall care. Do they have new medications on board? Do they have recent lab that is done? What's been going on with them medically? Anything different? Because those things are very important during this time. Just finding out if mom and dad are doing okay is good, but you need more information. And that's something that we can do as a geriatric care manager, and we're doing during this crisis with our clients, is we're making routine phone calls to discuss medical concerns. But that's something that anybody in the family could also do. But of course, we're happy to help if you need that. So we're here if you need us, okay?
That's a great suggestion, though. I think that it is easy to just, you know, whoever answers the phone and just say, how's mom? Where really we do need to know more information. So you're right. It's a tough time, and we're all in this together, but we're all navigating at the same time too, and trying to figure it all out.
We are. And one thing I want to leave on, which is a lot of times when I'm talking to caregivers, one of the biggest takeaways I want to share is our clients, when they start to become more confused out of the blue, we always want to make sure that they are having a UA or urinalysis done to rule out a UTI. We find that UTIs are probably 95% of the time that one of our clients has increased confusion, it's because of a UTI. And it doesn't always happen either at the doctor's offices or the facilities. That doesn't always happen where they get the UA. And it's not always something that's addressed. So it's important for you as a family member to keep that in mind. If your loved one starts to become more confused, it could be simply a urinary tract infection. So I encourage everybody to take that away, if nothing else, from this conversation, that if you find that your loved one has increased confusion, that you're addressing that first. Don't just assume that they've progressed in their Alzheimer's disease. Don't assume that that's just they're just getting old. Don't just assume that, but make sure you rule out that first, the urinary tract infection. Okay.
Great. Thank you.
I really thank you, Taylor, for taking the time and asking me to be a part of this today. I just wish everyone out there the very best. My prayers are with us all that this will be over soon and we can return to normal. But in the meantime, we want to keep everyone safe, especially our vulnerable senior population. So with that being said, I send out many blessings to all, and thank you, Taylor, to you, and blessings to you as well.
Thank you for your time today, Genevieve. We really appreciate it, and hopefully we'll have you on again soon. This was really valuable information.
Thanks so much. Have a great day.
You too.